Let's go.
I know what? Come here. We're gonna fight. Get away from me. You're not going anywhere.
Stop! Oh!
Oh my God!
My side!
Hi, Miss Jones. I'm Melina. I'm going to be your nurse today. Can I get your name and your date of birth?
Jackie Jones, March 5th, 1978.
Perfect. How are you feeling today?
My side really hurts. It hurts really bad.
It hurts on a scale of 1 to 10.
20.
To 20?
Yeah.
Alright, so I'm going to go ahead and take a look and see. Take a look at it, okay?
Ow, it hurts. Don't touch me.
I'm
Ow.
just going to take a look at it.
Ow. It really hurts. Just give me my medicine.
Okay. It looks good. It's still wrapped from last night from when you came in. Do you know where you're at?
I'm at the hospital.
Do you know how you got here?
I got into a bar fight, and all I remember is this crazy girl was following me, and then that's all I remember.
Alright, so then I'm going to go ahead and go get your medications, and I'll be right back, okay?
All right, hurry up.
Safety is always a main priority for healthcare professionals, especially when caring for patients. As nurses, it's our responsibility to obtain a thorough patient assessment. This is to ensure medication safety and to eliminate errors that could occur. Patient assessment is also vital to monitor for drug interactions, adverse effects, and noncompliance for the prescribed dose. Before giving vancomycin, metformin, and Lortab, you want to make sure to 1. Obtain a medical history and ask about other medications the patient is taking. 2. You want to perform a thorough head-to-toe assessment. 3. Vitals are important, such as blood pressure, pulse, and respirations. 4. You want to obtain a history of current symptoms of hypersensitivity or allergic reactions, such as rash and pruritus. 5. You want to obtain a history of pre-existing nephrotoxicity, kidney, or ototoxicity, which are ear problems. 6. You want to assess patients' infection before and during therapy, especially for vancomycin. 7. Obtain a specimen for culture and sensitivity before giving vancomycin. 8. Assess the patient's blood glucose levels with an A1C testing to prevent hypoglycemia. 9. Interaction between metformin and iodine-containing contrast for CT scans causes renal failure and lactic acidosis, so you want to discontinue metformin the day of or 48 hours after administration. 10. You want to check for kidney function with a BUN or creatinine test, liver function as well for AST and ALT testing. 11. You want to assess the type, location, and intensity of pain prior and 1 hour following an administration for Lortab. And 12, you want to assess for bowel function.
Alright, Miss Jones, I'm here to give you your Lortab. What Lortab is, it's for your pain. It's part acetaminophen and part hydrocodone. You might feel some drowsiness, you might start feeling sweating, and you also might feel some dizziness. So I don't want you to get up and go to the bathroom without my assistance, okay?
Mm-hmm.
So here it is. It's 325 milligrams, 2 tablets, okay? And here's your water.
Melina knows that Lortab have a mixture of acetaminophen and hydrocodone. They block pain receptors in the brain, decreases pain, and causes dilation of blood vessels. It is excreted through the urine and metabolized in the liver. Drug interactions include alcohol, CNS depressants, warfarin, and beta blockers. Side effects to Lortab is low blood pressure, sweating, dizziness, and drowsiness. Nursing interventions. Nurse will monitor respiratory depression and monitor for any adverse side effects. Patient education. Patient should change positions slowly to avoid orthostatic hypotension, avoid alcohol, and report any adverse side effects.
Alright. So I'm here to give you your metformin. Okay, it's 500 milligrams. You're gonna get that twice a day. So this is the first time for today. Before I give it to you, I want you to know to let me know if you feel any nausea, any diarrhea, or if you feel any bloating. Okay, so let me go ahead and get you a glass of water, your medication.
Melina knows metformin works by lowering glucose production in the liver. It leaves the body through the urine. Contraindications for this patient would be renal disease, renal dysfunction, alcoholism, and heart failure. Adverse side effects from metformin can cause bloating, nausea, diarrhea, may experience weight loss, low blood sugar, metallic taste, and lactic acidosis. Interactions with metformin when using iodinated radiologic contrast media. Metformin therapy should be discontinued the day of test and for at least 48 hours after the patient undergoes any radiologic tests. Patient education. If there are any adverse side effects, immediately call the physician. Check blood glucose levels after and before every meal. Do not skip any doses and must eat after every dose of insulin. Nursing interventions would be ensuring the patient receives metformin 30 minutes before giving food and checking blood glucose levels before and after meals.
All right, Ms. Jones, I'm here to give you your vancomycin. It's going to be 1 milligram infused for 24 hours for the next 7 days. I want you to let me know right away if you start hearing any ringing in your ears, if you start to feel any dizziness, any nausea. That could be a sign of hypotension. Also, if you could start seeing red man syndrome, and what that is if you start seeing any redness on your arms, any flushing in your face or neck. Okay, and I want you to let me know right away. So I'm going to go ahead and administer this.
Melina knows vancomycin is an antibiotic that destroys bacteria by producing death of the cell. This medication is restricted to IV administration only. Therapeutic goals for vancomycin is to treat infected site and the symptoms. They should have improved appetite, energy level, and sense of well-being. Adverse side effects are kidney damage, ringing in the ears, low blood pressure, red man syndrome, which symptoms like flushing of the face caused by rapid infusion. Nursing implications. Monitor therapeutic serum levels throughout therapy. This is key to prevent toxicity. Monitor I&O and evaluation of IV site. Patient education. Instruct the patient to report any adverse side effects, and patient must follow up appointments to monitor serum drug levels.
Good morning, Ms. Jones. My name is Diane, and I'm your caseworker. Your nurse tells me that you're going to be discharged later on today, and I'm here to set you up with some resources before you leave. I was looking through your file, and I noticed that you don't have any health insurance at the current moment, and I also saw that you're an Army veteran. So I was going to go ahead and do some research and see if I can get you some health insurance coverage through your military benefits. But in the meantime, you will be able to get your metformin prescription through Publix. And I also have here a list of homeless shelters that you can go ahead and stay at after you get discharged. And I do recommend the Coalition for the Homeless. They're a really good shelter. And I also have here for you a bus pass to get you there safely. And my number is also there in case you need to contact me. Is there anything else I can help you with?
No.
Okay, I hope you get better.
Thank you.
You're welcome. Goodbye.
All right, Ms. Jones, I'm going to go ahead and talk to you about your medications because you're going to be leaving sometime today, okay? Starting with your metformin, whenever you leave, I want you to call us or come back if you feel any adverse effects that what we talked about earlier. It could be the dizziness, nausea, anything like that. You are going to want to check your blood glucose levels before and after any of your meals. And then you're also, do not skip any doses, and you must eat after every time you have your insulin, okay? And then for your vancomycin, I see that they already did the PICC line. What you're going to do is you're going to make sure you scrub your hands really well before you clean it and pat them dry with a dry paper towel. You're going to want to change it every 7 days or more before that if needed. If you notice any leaking, any discharge from it, you're going to want to just change it. And then clean the catheter caps with alcohol swabs prior and after each use. Okay. So then for your Lortab, that's the medication, that's the mixture of acetaminophen and the hydrocodone. I want you to be sure not to take any more Tylenol because that's the same thing as acetaminophen, and you could increase your risk of liver failure. And also for that, just make sure you don't operate any heavy machinery because it can make you dizzy, drowsy, and call us if you have any more, or immediately if you have any adverse effects.
Okay, thank you.
All right, we're here to take you out. Before you go, I just want to let you know that we've already scheduled your appointments for the outpatient visits that you're going to be coming in for every day that you're on the vancomycin, okay?
Okay.
All right, so let's go ahead and get you out of the bed. Just a second. All right, go ahead and swing your legs over. Up, sit in the chair. Perfect. All right, she's good to go.
Bye, homeless. Sayonara. See you in the forest.